Ever wonder if those problems you brush off as just getting older might actually be warning signs of a serious health issue? Studies show that Sjogren's syndrome affects up to 4 million Americans, but most people don't get a proper diagnosis until 4 years after their first symptoms show up. While many people know about common autoimmune problems like rheumatoid arthritis or lupus, Sjogren's doesn't get much attention even though it's one of the most common autoimmune disorders in the United States. The Sjogren's Foundation says this delay in finding out you have it can really hurt your daily life and may lead to serious health problems if not treated. Why is this condition so hard to spot? The early signs often look like everyday issues that people tend to ignore or blame on aging, stress, or side effects from medications. But catching these signs early could make a huge difference for your health. In this video, I'll show you 10 small but important warning signs of Sjogren's syndrome that you should always pay attention to. Starting with sign 1, dry eyes. One of the biggest clues of Sjogren's disease is eyes that are always dry. This isn't just the normal eye tiredness you get from looking at screens too long or from allergies. The dryness happens because your body's defense system attacks the tear glands that make moisture for your eyes. Tears do more than just show sadness. They keep your eyes wet, fed, and protected from germs. People with Sjogren's often say their eyes feel sandy or gritty, like something is stuck in them all the time. This can feel like a mild bother or hurt so much it gets in the way of normal life. You might start to hate bright lights, making sunny days or bright rooms hard to handle. Some people say their eyes feel sticky or they have trouble opening their eyes when they wake up. Blurry vision that comes and goes during the day is also common. This happens because without enough tears, your eye can't focus light properly. The dryness can also make your eyes look red and feel sore. To check for this problem, eye doctors often do a simple test where they put small paper strips under your lower eyelids to see how many tears you make in 5 minutes. 2. Dry mouth. The second major sign of Sjogren's disease is very dry mouth. This isn't just being thirsty sometimes. It's a mouth that feels dry all the time and can really affect your daily life. In Sjogren's, your body attacks the spit glands, so they make much less spit than normal. Spit does more than just keep your mouth wet. It helps you talk, swallow, taste food, and keeps your teeth safe from decay and your mouth free from infections. Without enough spit, all these things become harder. Many people say they need to drink water all day and night. Some carry water bottles everywhere, needing that extra moisture just to speak clearly or swallow food without trouble. Dry foods like crackers or bread can become almost impossible to eat without taking drinks. What used to be enjoyable meals turn into careful eating exercises with lots of sipping. This problem can change how and what you eat, which might affect how well you're fed. The lack of spit creates the perfect setting for tooth problems. People often get more cavities, sometimes in unusual places like near the gums or at the roots of teeth. Dentists often notice this pattern before anyone figures out it's Sjogren's. White patches in the mouth from fungal infections become more common because the natural germ fighters and spit are missing, letting infections grow more easily. Some people feel a burning feeling in their mouth, especially on the tongue. This can be very upsetting and hard to deal with. The tongue might look red, smooth, or have deep cracks because it's so dry. 3. Brain and nerve problems. Beyond the usual dryness symptoms, Sjogren's disease can also affect your brain and nerves. These nerve problems often aren't recognized as being part of Sjogren's, which leads to confusion and delays in getting the right treatment. Many people experience tingling and numbness that feels like pins and needles or burning in their hands and feet. These odd feelings typically start in the hands and feet, sometimes moving up the limbs like wearing invisible gloves and socks. These feelings can range from slightly annoying to very painful. Thinking problems, sometimes called brain fog, can really affect daily life. People report trouble focusing, forgetting things, and problems finding the right words. These thinking issues can be especially upsetting because they often affect work and talking with other people. Headaches, especially bad headaches with nausea, happen more often in people with Sjogren's. These headaches often come with being extra sensitive to light and sound, and regular headache medicine might not work well. More serious nerve problems can develop in some cases. Spinal cord inflammation can cause weakness, changes in feeling, and bladder or bowel problems. This needs quick medical help to prevent lasting nerve damage. Some people develop conditions that look like multiple sclerosis, making it hard for doctors to figure out what's wrong. The similar symptoms sometimes lead to wrong diagnosis before the connection to Sjogrens is found. Special scans may be needed to tell these conditions apart. In rare cases, brain inflammation can happen, showing up as confusion, seizures, or behavior changes. This serious problem needs immediate medical help and often care from brain and nerve specialists. Damage to tiny nerves in your body can cause intense burning pain and sensitivity to temperature. This type of nerve damage is particularly hard to diagnose, as regular nerve tests might look normal. 4. Heart problems. The link between Sjogren's disease and heart health isn't widely known, yet it's an important concern for patients. The ongoing inflammation that happens with autoimmune conditions like Sjogren's can hurt blood vessels and heart tissue over time. Inflammation around the heart occurs more often in Sjogren's patients. This typically feels like sharp chest pain that gets worse when lying down and feels better when sitting up or leaning forward. Some people describe the pain as stabbing or knife-like. Irregular heartbeats may develop without any clear cause. People sometimes report feeling their heart skip beats or race suddenly, feelings that can be scary and disrupt daily life. These heart rhythm problems may need medicine or more advanced treatments. Sjogren's raises the risk of developing inflammation of small blood vessels. This can affect blood flow to various organs, including the heart, causing damage over time. Reduced blood flow may cause chest pain or trouble breathing, especially during physical activity. Some patients develop inflammation of the heart muscle itself. This serious condition can lead to heart failure if not found and treated quickly. Signs often include feeling very tired, shortness of breath, and swelling in the legs and ankles. Problems with controlling heart rate and blood pressure can cause sudden drops in blood pressure when standing up. This leads to dizziness, feeling lightheaded, and sometimes fainting, which can be dangerous. Cold and color changes in fingers and toes frequently happens with Sjogren's. During these episodes, affected areas turn white, then blue, and finally red as blood flow returns, often with pain or tingling feelings. 5. Joint and muscle pain. Joint and muscle pain is one of the most common, yet often missed, symptoms of Sjogren's disease. Unlike the joint damage seen in rheumatoid arthritis, Sjogren's usually causes pain from inflammation without permanent joint damage. This can sometimes delay diagnosis, as X-rays may look normal. The pain pattern in Sjogren's is typically the same on both sides of the body. People most often report pain in the small joints of hands and wrists, knees, and ankles. This pattern of matching pain on both sides gives doctors an important clue when looking at complex pain problems. Morning stiffness lasting more than an hour strongly suggests inflammatory joint involvement. This stiffness usually gets better with gentle movement throughout the day. Muscle pain often comes along with joint symptoms. People may feel deep, aching pain in large muscle groups like the thighs, shoulders, and back. Some patients develop widespread body pain, with tender spots throughout the body. This widespread pain can be particularly hard to live with, affecting sleep quality and adding to feeling tired all the time. Blood tests often show signs of inflammation like high levels of certain blood markers. About 60 to 70 of Sjogren's patients test positive for a factor often seen in rheumatoid arthritis, despite not having that disease, creating another challenge for doctors not familiar with the condition. Trouble exercising and feeling worse after physical activity affect many people with Sjogren's-related joint and muscle problems. Early recognition and proper management of these symptoms can greatly improve function and quality of life. 6. Lung disease. About 1 in 5 people with Sjogren's disease develop lung problems, but these are often overlooked. Unlike the well-known dry eyes and dry mouth, lung issues can start slowly and quietly, making them hard to notice early on. The most serious lung problem is called interstitial lung disease, ILD. It causes swelling and scarring in the lungs. The first sign is often shortness of breath during physical activity, which many people think is just due to aging or being out of shape. Another warning sign is a dry cough that won't go away, especially one that doesn't bring up mucus. This can be a sign of bronchiolitis, which is swelling in the small airways of the lungs. The cough often gets worse at night or early in the morning and usually doesn't get better with regular cough medicine. People with Sjogrens may also get bronchitis or pneumonia over and over again. This happens because the protective mucus in the airways becomes weaker. These infections may take longer to go away than normal. Pleurisy is another lung issue. It causes sharp pain in the chest that gets worse when you take a deep breath. This pain is usually felt on one side and might spread to the shoulder or back. Lung tests often show a restrictive pattern, meaning the lungs can't fully expand to take in enough air. Even small changes on these tests are important and should be watched closely because the condition can slowly get worse. A high-resolution CT scan of the chest can show lung problems even before symptoms appear. These scans help doctors find the exact type of lung damage, which helps decide the best treatment. Catching problems early with a scan can help slow down or even stop the disease from getting worse. 7. Kidney dysfunction. Kidney problems in Sjogren's disease are often missed, but they can seriously affect both daily life and long-term health. The most common kidney issue is interstitial nephritis, which is swelling in the kidney tissue between the tiny tubes that filter the blood. This condition can quietly cause damage without showing clear symptoms. Regular urine and blood tests might catch small changes before any signs appear. Nocturia, or needing to pee a lot at night, is a common problem. Waking up many times to go to the bathroom can disturb sleep, leading to tiredness during the day and trouble thinking clearly. Another problem is renal tubular acidosis, RTA, where the kidneys can't keep the body's acid levels in balance. This can lead to extreme tiredness, weak muscles, and kidney stones. In more serious cases, low potassium levels may cause irregular heartbeats. Some people with Sjogren's also develop nephrogenic diabetes insipidus, which causes constant thirst and frequent urination. This happens because the kidneys don't respond properly to the hormone that controls water balance. The constant loss of water can make other symptoms, like dry mouth and dry eyes, even worse. Finding protein in the urine, called proteinuria, is an important sign of kidney damage. Catching it early gives doctors a chance to treat it and help prevent the kidneys from getting worse over time. 8. Blood-related symptoms. Blood changes in Sjogren's disease can give helpful clues for diagnosis and may point to other serious problems that need close attention and care. These blood-related issues can range from mild lab results to serious health risks. One common problem is anemia of chronic disease. Unlike iron deficiency anemia, this type happens because long-term inflammation gets in the way of making healthy red blood cells or shortens their lifespan. Leukopenia, or low white blood cell count, especially affects neutrophils, which are key cells that fight off bacterial infections. Fewer neutrophils mean a higher risk of getting sick from infections. Some patients also get thrombocytopenia, where platelet levels drop. Since platelets help with blood clotting, low levels can cause easy bruising, longer bleeding after small cuts, and in serious cases, bleeding without any injury. Hypergammaglobulinemia means there's an increase in certain antibody proteins in the blood. This is a common sign of an overactive immune system and is often seen in Sjogren's disease. The most serious risk is a higher chance of developing non-Hodgkin lymphoma, especially a type called malt lymphoma. People with Sjogren's are 14 to 44 times more likely to get this than the general population. Signs like swollen salivary or tear glands, weight loss without reason, night sweats, or swollen lymph nodes should be checked by a doctor right away. Another condition linked to Sjogren's is antiphospholipid syndrome, which causes abnormal blood clotting. This raises the risk for blood clots in the legs, DVT, lung clots, pulmonary embolism, and pregnancy problems. Because of these risks, regular blood tests are a key part of managing Sjogren's disease. 9. Nervous system involvement. Sjogren's syndrome doesn't just affect glands and organs, it can also impact the nervous system. This causes symptoms that look like other nerve diseases and makes diagnosis harder. One of the most common nerve problems is peripheral neuropathy. This usually causes numbness, tingling, or burning feelings in the hands and feet. Sometimes it can also cause muscle weakness and trouble with coordination. These symptoms often get worse at night and can make walking or using your hands difficult. Small fiber neuropathy affects the tiny nerve fibers that sense pain and temperature. It can cause strong burning pain, sensitivity to touch, and problems with automatic body functions like heart rate or digestion. Sometimes, the central nervous system, brain, and spinal cord can be affected. This leads to cognitive problems often called brain fog. People may forget things, find it hard to focus, or feel mentally tired. These issues can be mistaken for normal aging or depression. In rare cases, inflammatory spots like those in multiple sclerosis, MS, may appear in the brain or spinal cord. These can cause vision trouble, balance problems, or weakness on one side of the body. This sometimes leads to a wrong diagnosis. Catching these nerve symptoms early and seeing a neurologist is very important. Tests like MRI scans, nerve studies, and skin biopsies help confirm the diagnosis and rule out other diseases. 10. Gut and liver problems. Sjogrens syndrome is usually known for causing dry eyes and dry mouth. But it can also affect the digestive system, and many people don't realize this. These issues can lead to poor nutrition, discomfort, and long-term damage to important organs. Many people with Sjogrens have trouble swallowing, which is called dysphagia. This happens because the throat is dry and there isn't enough saliva. It can cause choking, heartburn, or the feeling that food is stuck in the throat. Another common issue is esophageal dysmotility, when the muscles in the food pipe don't move in the right way. This can lead to acid reflux, chest pain, and bloating. In serious cases, it may even cause a type of lung infection called aspiration pneumonia. Sjogrens can also affect the liver. It is linked to liver diseases like primary biliary cholangitis, PBC, and autoimmune hepatitis. These illnesses cause long-term swelling in the liver. Signs include tiredness, itchy skin, stomach pain, or abnormal liver test results. Some people also have problems with the pancreas, the organ that helps digest food. When it doesn't make enough enzymes, it's called pancreatic insufficiency. This can cause diarrhea, weight loss, and low levels of vitamins A, D, E, and K. Regular blood tests, scans, and endoscopies can help find these problems early. That way, doctors can start the right treatment to stop things from getting worse. If you found this information helpful, please like this video and subscribe to our channel. We share more health tips that could protect your well-being. Watch our other videos on the screen. Your support helps us spread important health messages to more people.